Celiac Disease Awareness Month, and tonight we want to focus on the disease and why it's becoming more common. We have two health professionals from Summit Medical Group joining us now. Dr. Sarkis Chobanian is a gastroenterologist. Did I say that correctly?
A GI guy.
A GI guy. He's not even going to correct me there. I butchered that, but thank you. And also Suzanne Celtica. She's a health educator and registered dietitian, and we really appreciate both of you being here. And I know that you love hearing more and more people are aware, becoming more familiar with celiac. But doctor, let's talk about what it is exactly.
It's a fascinating disease because it has so many different facets. It's not an infection. It's a combination of a genetic predisposition, a toxic effect from wheat and other grains like it, and then the body's immune response to that wheat poison in these individuals.
How does it impact an individual?
Well, it basically damages the lining of the small intestine where much of the absorption of the body's nutrients occurs. And patients can have abdominal pain, cramps, bloating, diarrhea, weight loss, and they can have many vitamin deficiencies, iron deficiency, B12 deficiency, many different facets.
Yeah, how do you diagnose this? Is it a challenge there?
Well, it's the reason why we're seeing many more of these cases because the diagnosis has become easier over the last decade or so. Blood tests have arisen that we can now screen many patients for the disease based on their symptoms. Many years ago, it had to be a very intensive and invasive small bowel biopsy, not a lot of fun. So with a blood test now that gives us an idea who might have it, we do follow that up with a biopsy, but now the biopsy is much easier. They're sedated for it.
Okay, and one of the best ways to treat this is a diet, a gluten-free diet?
A gluten-free diet. So in a gluten-free diet, we'd be watching things like wheat, rye. Sometimes people are sensitive to oats, but basically wheat, rye, and barley are the things that we look at.
And you say that, and many people may be thinking, oh my gosh, that's pretty much everything that I eat. It's impossible to find something that's going to be healthy for me, but certainly not the case. Give us an idea of what a gluten-free diet looks like, and you know how it's different from our standard diet.
Sure. The easiest way to describe a gluten-free diet is going back to the basics. So taking out a lot of our processed foods and going back to meats and fresh produce is the easiest first step for a new gluten patient. And then we can look deeper and look at label reading and other gluten-free options that they can introduce to their diet. But that's a great start. Anything that has processing in it, anything with extra additives are always something they have to have a heightened awareness to, because that can cause complications in having those additives contain those products that they're sensitive to that's causing the problem.
Is this the only way to treat celiac, is through diet changes?
Unfortunately, right now it is. I know some pharmaceutical companies are looking at drug therapy for it, but right now nothing is on the market. It's a gluten-free diet, which is very, very difficult.
And it's even become popular, though, for people that don't have celiac disease. Talk about its growing popularity and why, the benefits there.
Well, I'm not sure if there are benefits. There hasn't been a gluten-free diet founded for anybody other than celiac right now. People are trying to use it for weight loss, and it's really not founded for that as well. As we try to replace gluten in the diet, we add things like sugar, we add things like fat to help the texture, to help the fluffiness of those products as gluten has been removed. And actually, it adds to extra calories.
Okay.
So it's nothing that's really that desirable. In addition, like the physician said, we look at also the nutrients that we've lost. Fiber, vitamin D, the B vitamins.
So you're going to have to supplement that through other foods?
Potentially.
Okay.
So those are things that, you know, right now, today, we aren't recommending at all.
Very interesting. We certainly appreciate you both being with us today, and I know that you're thrilled that more people are becoming familiar with celiac disease.
Absolutely.
That's part of your job.